Hi, my name's Dr. Nancy Kim. I've been working at the Christiana Spine Center for almost 17 years, so it's been a while. But a common question or reason for patients to come and see me is for low back pain. So low back pain is very common. It's one of the top reasons to see a physician. So one of the things that is important to understand is to treat back pain, you have to know where the back pain is coming from. So oftentimes when patients come to see me, they'll tell me, gosh, I have this horrible back pain. Where is this coming from? So in order to answer their question, I always have to go back to anatomy, which is the fun stuff. But when I see someone who comes into my office, who comes in with complaints of back pain, the first thing I try to figure out is where is that back pain coming from? So our spine is made up of many different structures, and that's why back pain is so difficult to treat. There's so many parts to it. So there are potential areas that are common pain generators, is what we call it, for low back pain. So this is a spine model here, and just to get oriented with the spine model, this is actually your back. So when I'm pressing on your low back, this is where I'm pressing on. And this is actually the front of the spine. So your belly's here, behind it is the spine. It's just a deeper structure. So common causes for back pain can be very simple. So one, it could just be your muscle. We call it a muscle strain. But typically that will usually go away after a few weeks, maybe a few months, but it sort of always kind of gets better at some point. And then we have ligaments, where we call it a lumbar strain. That's another common area for pain in your back. And then we have the deeper structures. So we have these tiny little joints in our spine called facets. These tiny joints, when they get arthritic or swollen, can cause pain in your back. This is the front of the spine. So we see the disc, which are little cushions that we have in between each block of bone or vertebrae. When we have a tear in the disc, you can get pain in your back. These blocks of bone here, which are the vertebral bodies, if there's a fracture, that can also be a potential source of pain. So back pain is very complicated, and that's one of the reasons why it's important to see a specialist, because we'll be able to help you identify which structure is causing your pain and then treat it appropriately. So I hope to see you at our office.